Hi everybody, this is Rhys Barber from Audiology Associates. We've got an interesting case here for you today. Now this is actually my patient, this first one, which was just some really hard plugs inside the ear canal. Make sure you stay tuned for Taylor's patient second. We've got a false fundus coming up for you guys, and it was quite an interesting one as well. So this one here, we've just got very, very hard wax sitting right in the entrance to the canal, very, very thick, not really giving us a lot of room either side here to get this out. So I've just got to work this wax down the canal. There we go, out that comes. It's a combination actually of wax. It looks like a bit of dry skin there, that lighter material right at the entrance, but came away really cleanly. I like the way that came away there. So just going in now with the fine end. Let's just grab this little ridge of skin. Let's just see if this lifts. It looks like it might lift. There you go, that's what we wanted to see. That lovely peel down the canal. And I opted there to go for a slightly different technique. I dropped over the top and drew back down the canal. And sometimes if you can just see enough of the skin is sort of rolled over just at the top of that ridge, if you can just hold on to that and just draw it down, it will tend to pull a lot of that out with it. But the eardrum looking really, really healthy there. So this is the other ear canal, very, very similar. Difficult to see because there's a lot of very, very fine hairs. Now, when you saw on, I saw in the comments recently that people were talking about these hairs and saying, oh, you know, can you go in and sort of trim the hairs beforehand? I suppose you could. They do have quite an important job. They do stop a lot of the larger bits of dust and debris from entering the canal. So that does tend to have you know, an impact if you trim those hairs. But you know, from my side of things, because I've been doing this so long, you kind of get used to working around them, I've got to be honest. Although I did do a training course once and they did say, you know, to go in there with a set of crocodile forceps, just grab the hairs and yank them out. I certainly wouldn't want that done to me. But yeah, you can see it's coming away really, really well here. Just this little ridge, same on the other side. But looking good, and eardrum looking absolutely fab. So I would say if I squish those two together, it's going to be about 1.5 centimeters, or just under 3/4 of an inch on that one there, guys. So this was the page I was telling you about earlier. Quite an interesting one. I remember looking at this one. I edited the video in. I was thinking, wow, that's quite interesting. So what we've got here is basically a very thick layer of soft wax surrounded by a layer of dead skin. So we've actually got this sort of layer of dead skin that wraps around this softer wax plug here. Now this is Taylor's patient, so Taylor's going to be taking this away today, and it's got this really, I'd say sort of harder texture right in the middle here. He's having to negotiate that sort of harder texture and the softer sort of dead white skin layer you can see around that outside edge. Now those dead skin layers, when you see that very, very thick white layer, much harder to remove. It's going to be a tough old removal for Taylor, this one. The reason being, right, where you've got that thicker layer around the outside edge like that, that is bound to the canal wall. So that really doesn't want to let go of the canal wall. But in the middle of that, you've got this kind of odd consistency of wax, which is really firmly attached and almost sort of layered on top of that thick layer around the outside edge. So what you've got here is every part of this plug is going to fight Taylor for every millimeter of movement in here, because everything is bound to each other. And then you've got that thicker layer. Now, normally what we would try and do is peel that layer, sort of drag the edge and peel it down the canal to draw that off. But you can't do that because you've got that thick plug in the middle. So we've got to address the plug first before we can get this out. Now, sometimes if you are really, really fortunate, you will hold that central plug, and because everything's bound together, if you get a really good suction grip there, you'll be able to pull it and the whole thing will come out. Now the difficulty is if you look at the surface texture of just the plug in the middle, you'll see that it's very undulating, that texture. There's not a smooth surface to get a grip on. Now when you're using suction, obviously you want quite a smooth-ish surface. The ideal surface is smooth but slightly soft, so the suction can bed in and it'll give you a really good suction grip. But with this type of surface, where that's that sort of undulating surface, what happens is the suction grip can't get a great, suction tube I should say, I'm really sorry, can't get a great grip on that plug so it can't pull it out. So you can see Taylor is working around the outside edge. He's introduced some oil in here, and sometimes that will help. As you're wiggling there, it just allows a little bit of oil to penetrate underneath the plug, and then you can draw this down. But it's really just not budging very well. Ooh, that's a good grip. That's a good grip. Now he's opted to aim for that thicker white dead skin layer on the top, and that's a great place to have that suction tube, because as I said, it's got a flatter, softer surface. The suction tube beds in, gives you a really good hold on that then. And he's really wiggling this here. There we go, and out that plug comes. Whoa, that was a sizable chunk. Fair play. Eardrum beyond, looking good. Slight dullness there, but not too bad. So what have we got here then? This is a harder section of wax. You can see a very different color. It almost looks like a very different consistency here. Now this is either going to be super hard or it's going to be super sticky and soft. Which way are we going with this? Super hard. Okay, so he's going to lift this. If he's really lucky, what will happen is you'll grab an edge. With these are always lovely ones to do if this happens. You grab an edge, you lift it, and then the whole sides peel away. And it's always a really good one when that happens. But he's really trying to peel this side off. Let's see if this all connects. What's going on underneath? I don't want to look into the side. I won't be able to see any better. You've got this whole sort of side section. I think this harder wax section here is sitting on top of a thicker skin layer. Ooh, now this is interesting. Ooh, could he get... You're always in kind of two minds. Do I go in there with maybe a curette, you know, and just draw that edge down a little bit further? But it's actually, you know, it's moving with the suction tube. But see how stiff everything is? It really, really wouldn't surprise me. I can't actually remember this bit, but it really wouldn't surprise me if this whole thing is one continuous piece of skin with all this wax sitting on top of it. It's coming, it's moving. Oh, you can see as he's rocking back and forth. Look behind how the whole thing is just wiggling back and forth. Oh, could you get a set of forceps on that, I wonder, maybe? Ah, there you go, forceps. Let's see if we can get those onto that. It's not the greatest of angles. With the forceps, ideally you want it kind of flat so the forceps can go in and grab it. When the end is bent down like this, it's difficult to get the angle. You know, you'd have to drop the forceps right down to be able to get that angle in there. Ooh, can he get this out? It's looking promising. It's looking promising. But from what you can see just at the entrance, it's pulled the next section further. So it really was all connected together. Wow, look at that. I'd love this to be a really big chunk now. Let's see what happens. Yeah, go on. Oh, it's so tantalizingly close. It's there, but it just doesn't want to come away. If you can grip that piece of skin, see that white piece of skin at the top, if you can grip that, I think it's gonna really pull. It's whether there's enough of an overhang, if you like, of that skin to be able to pull this out. Oh, there you go, there's the skin. So that took a nice big chunk out. But what we're left with now is a harder section. This looks like it might be a little bit more brittle. Is that gonna go? Yeah, see it. So it's shearing these little bits off. It's not really kind of. I can see what he's trying to do, but if you look beyond, if you just looked at just beyond where the forceps are, that next section go. Ooh, that's nice. That next section was curling up, and I thought he's gonna have difficulty there. Yeah, there you go. Now that might have to be a different tool, maybe. What can Taylor see here? Can he see an edge? You could actually go back to suction at this point as well if you wanted to. Oof. There we go. And look at the left-hand side, there's a thick white layer of skin on that left-hand side as well. It's almost there. Oh, there we go. Wow, it's really coming away now. Look at that. Look at that plug. My goodness me. Now, here's the false fundus. You can see that you should be seeing an eardrum here, but this is a thickened layer of skin. Now, false fundus is something that you get when it's usually followed by, following on from repeated infections, damage to the ear canal wall skin. And what you end up with there is that natural epithelial migration just doesn't occur as well. And you end up with this thickened, almost like a skin blockage, for want of a better word, inside the ear canal then, and that can cause lots and lots of issues as far as things like hearing and other bits and bobs. 7 centimeters, 2 3/4 inches of wax and skin. Oof, well done, Taylor Green. That was a tough one to do, fair play. Well, guys, I hope you enjoyed that video as much as I did voicing it over. Sorry, I got a bit excited towards the end of the false fundus video. If you do enjoy the videos, don't forget, please like, heart, share, follow, subscribe, do all those things. We smash that like button, let other people know this is a good video to watch. And then, as always, guys, take care of yourselves, take care of your ears, and take care of one another. And fingers crossed, myself and lovely Miss Taylor Green will be with you again soon. Bye, everybody.